Welcome to another MU Healthcare Ask the Expert podcast. I'm your host, Cosmo, from the Y107 Morning Show, Cosmo and Cat Show. And, when a routine ultrasound shows something unexpected during pregnancy, families want answers, and they want some expert support. And MU Healthcare's new Fetal Care Program offers just that. And our expert today for our podcast, we've got Dr. David Streitman, a maternal fetal medicine specialist. Doctor, let's start with this first question. What exactly is the Fetal Care Program, and why is it such a game changer for mid-Missouri families?
Well, our Fetal Care Program is a specialized service that offers advanced care and support for pregnant women experiencing high-risk pregnancies with fetal complications. If there's a concern for the baby during the pregnancy or something unusual shows up on an ultrasound or other imaging test, our Fetal Care Program is designed to handle all of that. Diagnosis, treatment, and even surgery if needed in the womb, all in one place. A lot of people used to travel far distances to St. Louis, Kansas City, or even out of state to obtain this kind of care. Now they can get that same level of specialized care here in Missouri.
We've got Dr. David Streitman, a maternal fetal medicine specialist, here with us. We're talking care for babies before they're born, right?
Correct. Baby's still in the womb. But really, since our fetal program is part of our larger maternal fetal care center, which is home to so many other specialties, it's care for babies and mom before, during, and after the baby's birth. I'm a fetal interventionalist and part of the maternal fetal care team. So we've got OBGYNs who specialize in complex pregnancies who take care of mom and work together with any of our other 80 specialties she may need, like our cardio-obstetrics experts if her heart is a concern. And for baby, we have neonatologists from our level 3 NICU as part of our team, and they work with 30 other pediatric specialists, ear, nose, and throat, cardiology, and plastic surgery, for instance. So many others who step in depending on the condition and what baby needs.
What type of conditions can the Fetal Care Program help with?
We see quite a few and can provide special testing procedures to diagnose conditions like spina bifida, which is an open spine, and surgeries to correct or improve them, such as spina bifida. If a baby develops issues with their lungs, such as an airway blockage, we might perform a special delivery type called an exit procedure, where we partially deliver the baby but keep mom pregnant for the duration of the procedure while the baby is still being supported by the placenta and her womb. That way we can rely on the umbilical cord to supply the oxygen while we establish the baby's airway, sometimes with direct intubation with a tube, sometimes with surgery on the throat, so they can breathe on their own once they're fully delivered and disconnected from mom. Another example is something called twin-twin transfusion syndrome. That's when we have a set of identical twins that always share blood vessel connections through their placenta that they share. About 10 to 15% of the time, that sharing is imbalanced, and one baby ends up with more blood than the other, and we can actually put a small camera inside the womb and use a laser device to seal those blood vessel connections so that they each have their own separate circulations and can survive.
We have Dr. David Streitman with us, a maternal fetal medicine specialist from MU Healthcare, caring for complex issues for a baby still in the womb. That's pretty tall order, Doc. How does your team coordinate everything?
There are definitely many moving parts, sometimes upwards of 7 or 8 different physician specialists involved for the mom and baby. But we make it as smooth as possible for families. They're paired with a program coordinator in our maternal fetal care center as part of our fetal care program, a go-to person who helps families coordinate all of these issues, including appointments and other questions that pop up. We often schedule that single-day workup, that fetal care conference I mentioned before. So in one visit, the parents can get advanced imaging, get all the diagnostic information back. If there's been genetic testing, we can talk about that as well. And we can talk through next steps across the rest of the pregnancy and then the delivery and afterwards. This can be especially helpful for families traveling for hours to come see us. It's a long day, though, and they can become quite tired by the end of it. We also coordinate a lot of care outside our hospital because we know local care is so important to continue the management of the pregnancy. So we partner with their local OB to kind of keep them abreast of what's going on and involved in the care process, and they can give us feedback when complications arise.
We know that this is the first program of its kind in the region, which is a big deal on its own, but are there other components that make it stand out even more beyond that? Like, what makes the fetal care program different from others in the state or the surrounding area?
One of the big things is how we can care for moms at MU. We have some of the most experienced interventionists in the state, myself and a pediatric surgeon, and everything happens under a single roof in a single institution. None of the other programs in the state have both the pediatric and maternal care all within one big facility like we do. Our fetal care center, which houses the fetal care program, is connected to our birthing center via a bridge and also to the NICU. So if any issues arise or it's time to deliver, we can take mom and baby right over to the hospital. We've got a specialized operating room just steps away, which is especially equipped for this type of surgery. And actually it connects to a second operating room so that if we have, say, the exit procedure where we are keeping the baby connected to mom for a period of time, but then have to disconnect and then continue that urgent surgical care for baby, it's right next door. They literally walk through a door and they're in the next operating room. We also work closely with over 30 pediatric specialties, and we've made it easier for referring doctors to connect with us. Plus services like the Ronald McDonald House, which is right across the street from our hospital, help us to support these families through these difficult times.
Doctor, thank you so much. It's such powerful work, too, and great news for families here in mid-Missouri. If you'd like to learn more about the Fetal Care Program at MU Healthcare, go to muhealth.org/expert fetal care.